Hey guys, welcome back to my channel. My name is Sarah and I'm a family nurse practitioner. Today I'm going to take you guys to work with me for a 12-hour shift here at the urgent care. So my first patient of the day was a 10-year-old girl coming in complaining of right lateral ankle pain for the past few days after twisting her ankle during Taekwondo practice. On exam, the patient had tenderness and swelling to the lateral ankle and some tenderness to the lateral malleolus, so I ordered an ankle x-ray to exclude a fracture. Imaging of the right ankle was negative for acute fracture, and I diagnosed her with an ankle sprain. I wrapped her ankle in an ACE wrap, and the patient was discharged. My next patient actually came in with bronchitis, but I noticed a cerumen impaction during my exam, and I offered him an ear lavage. He said yes, and look at all that wax. Now y'all know I love a good ear lavage, and this one definitely didn't disappoint. Everyone is headed back to school soon, so I've been doing a ton of sports physicals. I really like these visits because they're usually short and very straight to the point. I have been noticing an increased amount of COVID positive patients over the course of the past few weeks. Thankfully, symptoms are mild though. They typically are coming in with a combination of these complaints: headache, sinus pressure, nasal congestion, sore throat, and sometimes a cough. Every case has been stable with very mild symptoms. Today, I diagnosed 2 patients with COVID and recommended supportive care. After a lot of trial and error, I figured out the best way to chart for me is to see the patient, order the tests that I want, and then while those tests are running, I complete the bulk of my charting for that patient. I performed wound care on 2 patients during this shift. One was an 88-year-old male with abrasions to the right hand after his hand got caught in his trunk. I dressed the wound and sent mupirocin cream to the pharmacy. The other patient was a 47-year-old male with left lower extremity redness, tenderness, purulent drainage, blisters, and ulcerations. I cleansed and I dressed the wounds, and I treated him with a 5-day course of Bactrim. Sometimes I'll have patients come in requesting strep testing or flu testing, and I know for a fact that their symptoms aren't consistent with it, and testing pretty much would be a waste of time and money. But working in the urgent care, they really emphasize patient satisfaction. So the way that I balance it is I'll tell them that I have a very low clinical suspicion for it, but I'm happy to run the test if they feel strongly about it. It was an interesting coincidence, but I had 2 back-to-back patients come in complaining of nausea, vomiting, diarrhea, and decreased appetite. I diagnosed both of them with viral gastroenteritis, so I decided to run IV fluids on both patients. At my clinic, starting IVs and running fluids are a provider task and can't be performed by the medical assistant, so I had to pull out some of those bedside nursing skills for these 2 visits. I honestly love having these patients because I like staying fresh with my skills of starting IVs. Like they say, if you don't use it, you lose it. I also drew up a dose of Zofran to be given IV push for symptom relief, and I discharged both patients in stable condition. For my next patient, I was put on a little babysitting duty while mom was close by getting an x-ray completed. She came in with low back pain and left inner thigh pain after slipping and falling in the driveway. When she slipped, she fell in a splits position. She actually showed me the ring footage. Imaging was all negative, and I diagnosed her with a muscle strain. I treated her with Flexeril, NSAIDs, and recommended icing, compression, and gradual stretching exercises. I have so many patients who come in daily complaining of UTI symptoms. And something that I realize is that it's so important to interview the patients well because oftentimes their symptoms won't be UTI symptoms at all, and I end up ordering a vaginitis swab or STI testing. So it is 10 after and I'm officially off work. Today was not a bad shift at all. I definitely saw less than 20 patients. So I can kind of tell that cold and flu and like school season is slowly approaching. I did a number of sports physicals today. The kiddos are kind of gearing up to head back to school. And I'm starting to notice a few more respiratory complaints. And that's just a nice reminder to me that cold and flu season is coming. And that's, to me, that's the busiest time in the urgent care. And I'm constantly seeing, those patients coming in with the respiratory complaints. And that's when I see the highest volume of patients. So to get myself mentally prepared, I'm going to Vegas tomorrow. I'm going for a few days. I just want to take a load off, relax, enjoy having a few drinks, laying by the pool, maybe sitting at a slot machine and betting a little bit of money and just having a good time in general. So my flight leaves tomorrow night. I'm going to kind of get everything situated at the house and with my kiddos tonight, and then I'm out of here tomorrow. All right, guys, thank you so much for hanging out with me today. Don't forget to like the video and subscribe to my channel, and I'll catch you guys in my next video. Bye.